Chapter 4, Pain. Copyright 2023, Elsevier Inc. All rights reserved. 1. Pain. Unpleasant sensation, discomfort caused by stimulation of pain receptors, body defense mechanism, warning of a problem. Complex mechanisms, many not totally understood. 1. Subjective scales developed to compare pain levels over time. Copyright 2023, Elsevier Inc. All rights reserved. 2. Inflammation, infection, causes of pain. Ischemia and tissue necrosis, stretching of tissue. When stretching of tendons, ligaments, joint capsule. When chemicals, burns, muscle spasm. Copyright 2023, Elsevier Inc. All rights reserved. 3. Somatic versus visceral pain. And somatic pain from skin, cutaneous bone muscle conducted by sensory fibers. When visceral pain originates in organs conducted by sympathetic fibers, may be acute or chronic. Copyright 2023, Elsevier Inc. All rights reserved. 4. Pain pathways. Nociceptors, pain receptors, are free sensory nerve endings, may be stimulated by temperature, extremes of temperature, chemicals. Examples: acids, bradykinin, histamine, prostaglandin, physical means. Example: pressure. Copyright 2023, Elsevier Inc. All rights reserved. 5. Pain. Pain threshold level of stimulation required to elicit a pain response usually does not vary among individuals. Pain tolerance, ability to cope with pain, culturally related, varies among individuals. Copyright 2023, Elsevier Inc. All rights reserved. 6. Nociceptors. Pain pathways. Stimulated by. And thermal means, extreme temperatures. Chemical, for example, acids or chemicals produced by body, for example, bradykinin, histamine, prostaglandin, physical, pressure. 7. Copyright 2023, Elsevier Inc. All rights reserved. Afferent fibers. Pain fibers, myelinated adelta fibers, transmit impulses very rapidly, acute pain. When sudden, sharp, localized. 1. Myelinated C fibers transmit impulses slowly, chronic pain. Undiffuse, dull, burning, or aching sensation. Copyright 2023, Elsevier Inc. All rights reserved. 8. Pain pathways. 1 of 4. Dermatome, area of skin innervated by a specific spinal nerve. Somatosensory cortex, mapped, and corresponds to source of pain stimuli. When reflex response, efferent response, involuntary muscle contraction away from pain source, involuntary muscle contraction to guard against movement. Copyright 2023, Elsevier Inc. All rights reserved. 9. Pain pathways. 2 of 4. Spinothalamic bundle in the spinal cord. Neospinothalamic tract, fast impulses, acute pain. Paleospinothalamic tract, slow impulses. Chronic, dull pain. Spinothalamic tracts connect with reticular formation of brain. Copyright 2023, Elsevier Inc. All rights reserved. 10. Pain pathways. 3 of 4. Somatic sensory area in the cerebral cortex, located in the parietal lobe, perception and localization of sensation. And hypothalamus and limbic system, emotional factors, and communication with other regions of the brain to integrate responses. And reticular activating system, RAS, reticular formation in the pons and medulla, awareness of incoming brain stimuli. Copyright 2023, Elsevier Inc. All rights reserved. Pain pathways. 4 of 4. 9. Somatosensory cortex, parietal lobe, locate pain brain. 8. Thalamosensory relay center. 6. Lateral spinothalamic tract, pain. 4. Synapse, spinal cord. 5. Spinal decussation, crossover. 2. Nociceptor, pain receptor. 11. Limbic system, emotional response. 10. Hypothalamus stress, response. 7. Reticular formation in pons and medulla, awareness, alert. Dorsal root, dorsal ganglion. 1. Stimulus. Copyright 201-420-112,1,200,217 by Saunders, an imprint of VI. 3. Peripheral nerve afferent pain fiber. Copyright 2023 Elsevier Inc. All rights reserved. 12. Physiology of pain and pain control. Gate control theory control systems. Gates built into normal pain pathways can modify pain stimuli conduction and transmission in the spinal cord and brain. Gates open. Pain impulses transmitted from periphery to brain. Gates closed. It reduces or modifies the passage of pain impulses. Copyright 2023 Elsevier Inc. All rights reserved. 13. Pain control gate open. 5. Pain perceived brain. 4. RAS alert. A. Spinal cord. Dorsal horn or substantia. Gelatinosa. 3. Pain stimulus to brain. Interneuron inactive. Nociceptor. 1. Painful stimulus. Peripheral nerve A delta and C pain fibers. 2. Substance P released at synapse. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023. Elsevier Inc. All rights reserved. 14. Pain control, gate closed. Other sites for endorphin and enkephalin release. Substance P neurotransmitter, enkephalin. 6. Gate closed transmission blocked on afferent tract, spinal cord. 5. Substance P not released. 2. Interneuron activated by efferent impulses from the brain or afferent impulses from touch stimulus, afferent touch of beta thick fibers. 4. Opiate receptors blocked by afferent pain fiber nociceptor. 3. Interneuron releases. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. Copyright 2023. Elsevier Inc. All rights reserved. Painful stimulus. 15. Characteristics of pain. Copyright 2023. Elsevier Inc. All rights reserved. 16. Signs and symptoms 1 of 3. Location of pain. Descriptive terms. Aching, burning, sharp, throbbing, widespread, cramping, constant, periodic, unbearable, moderate. In timing of pain association with an activity. In physical evidence of pain pallor and sweating, high blood pressure, tachycardia. Copyright 2023. Elsevier Inc. All rights reserved. 17. Signs and symptoms 2 of 3. Nausea and vomiting may occur with acute pain. Fainting and dizziness may occur with acute pain. Anxiety and fear, frequently evident in people with chest pain or trauma. Copyright 2023, Elsevier Inc. All rights reserved. 18. Signs and symptoms 3 of 3. Clenched fists or rigid faces, and restlessness or constant motion. Guarding area to prevent stimulation of receptors. Copyright 2023, Elsevier Inc. All rights reserved. 19. Young children and pain. Infants respond physiologically. Examples: tachycardia, increased blood pressure, facial expressions, and great variations in different developmental stages. Different coping mechanisms, range of behavior, often have difficulty describing the pain withdrawal and lack of communication in older children. Copyright 2023. Elsevier Inc. All rights reserved. 20. Referred pain. Source may be difficult to determine, and pain may be perceived at site distant from. Source. Characteristic of visceral damage in the abdominal. Organs: heart attack or ischemia in the heart. Copyright 2023. Elsevier Inc. All rights reserved. 21. Location of referred pain. Cardiac ischemia, biliary colic appendicitis, colon pain, cholecystitis pancreatitis, duodenal ulcer, renal colic, small intestine pain, ureteral colic. From Kopstead-Kirkon LC, Pathophysiology, ed. 4, St. Louis, 2009, Mosby. Copyright 2023. Elsevier Inc., all rights reserved. 22. Phantom pain, and usually in adults, more common if chronic pain has occurred. In following amputation, pain, itching, tingling, usually does not respond to common pain therapies, may resolve within weeks to months, in phenomenon not fully understood. 23. Copyright 2023, Elsevier Inc., all rights reserved. Pain perception and response, pain tolerance. Degree of pain, intensity, or duration may be increased by endorphin release, may be reduced because of fatigue or stress, varies among people in different situations. Pain perception subjective but can be compared from day to day in same person. Response to pain, influenced by personality, emotions, and cultural norms. Copyright 2023, Elsevier Inc., all rights reserved. 24. Acute pain, and usually sudden and severe, short-term. Indicates tissue damage, may be localized or generalized, initiates physiologic stress response, increased blood pressure and heart rate, cool, pale, moist skin, increased respiratory rate, increased skeletal muscle tension, and vomiting may occur, and strong emotional response may occur. Copyright 2023, Elsevier Inc., all rights reserved. 25. Chronic pain, one of two, occurs over extended time, may be recurrent, usually more difficult to treat than acute pain, and often perceived to be generalized. Individual may be fatigued, irritable, depressed, and sleep disturbances common, and specific cause may be less apparent, and appetite may be affected, can lead to weight gain or loss. Copyright 2023, Elsevier Inc., all rights reserved. Frequently affect pain, 2 of 2, frequently affects daily activities, accommodation and pacing of activities may be required, and periods of acute pain may accompany chronic pain conditions, usually reduces tolerance to additional pain. Copyright 2023, Elsevier Inc., all rights reserved. 27. Comparison of acute and chronic pain. Table 4:1 general comparison of acute and chronic pain. Acute pain tour. Chronic pain. A warning, fast, localized. Stimuli injury. Mechanical thermal pathway fast A delta myelinated fibers. Neospinothalamic tract response. Sudden short-term stress response. Increased pulse and blood pressure. Cool, moist skin, nausea, vomiting, emotion, anxiety. Treatment. If cause is identified, treatment is effective. Slow, diffuse, prolonged. Existing, chemical. Slow unmyelinated C fibers, paleospinothalamic tract. Long-term disabling, fatigue, depression, irritability, loss of hope, depression, anger, difficult to treat effectively. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc., copyright 2023, Elsevier Inc., all rights reserved. 28. Headache types and causes. 1 of 2. Congested sinuses, nasal congestion, eye strain, and muscle spasm and tension from emotional stress. In temporal area temporomandibular joint syndrome, migraine, abnormal blood flow and metabolism in the brain, intracranial headaches, increased pressure inside the skull, 29%. Copyright 2023, Elsevier Inc., all rights reserved. Headache types and causes 2 of 2. Central pain, caused by dysfunction or damage to the brain or spinal cord, and neuropathic pain, caused by trauma or disease involving the peripheral nerves. Ischemic pain results from a profound sudden loss of blood flow to an organ or tissue in cancer-related pain, caused by advance of the disease. Pain associated with treatment, result of coexisting disease. Copyright 2023, Elsevier Inc., all rights reserved. 30. Methods of managing pain. 1 of 5. Remove cause of pain as soon as possible. Use of analgesic medications. orally parenterally injection transdermal patch classified by ability to relieve mild pain, moderate pain, severe pain. Copyright 2023 Elsevier Inc. All rights reserved. 31. Analgesic drugs. Table 4-2 analgesic drugs. Action. Use name for mild pain. Acetaminophen NSAIDs. NSAIDs for moderate pain. Codeine oxycodone. Decreases pain at peripheral site. All are antipyretic ASA, and NSAIDs are anti-inflammatory. Acts on central nervous system and affects perception. Adverse effects. ASA and NSAIDs have many adverse effects: nausea, gastric ulcers, bleeding, allergies. Narcotic opium often combined with ASA. Acetaminophen high dose may depress respiration. Percocet Vicodin for severe pain. Morphine Demerol methadone acts on central nervous system, euphoria and sedation. Meperidine oxycodone, narcotic tolerance and addiction high dose depresses respiration, nausea, constipation common. ASA, acetylsalicylic acid aspirin. NSAIDs, non-steroidal anti-inflammatory drugs. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier Inc. 32. Copyright 2023 Elsevier Inc. All rights reserved. Methods of managing pain, 2 of 5. Sedatives and anti-anxiety drugs, adjuncts to analgesic therapy, promote rest and relaxation, may reduce dosage requirements for analgesic. When chronic and increasing pain may occur in cancer. Stepwise fashion to reduce pain tolerance to narcotics develops over time. Increased dose requirements. A new drug may be required. Copyright 2023, Elsevier Inc. All rights reserved. 33. Methods of managing pain. 3 of 5. Severe pain. Patients administer medication as needed. Patient-controlled analgesia, PCA, lessens overall consumption of narcotics. Intractable pain cannot be controlled with medication. Surgical intervention is a choice. Rhizotomy, chordotomy, when injections. Copyright 2023, Elsevier Inc. All rights reserved. Methods of managing pain. 4 of 5. Trigger point injections. Trigger points are focal areas of muscle spasm and infection of skeletal muscle. May be used to relieve pain for conditions such as fascial pain syndrome, fibromyalgia, headaches. Injections may include and local anesthetics, corticosteroids, and botulinum toxin A35, copyrights reserved. Methods of managing pain, 5 of 5, and surgical implants, intrathecal drug delivery. Spinal cord stimulation implants, transcutaneous electrical nerve stimulation. Therapy, TENS, non-invasive, using low-voltage electrical current. Bioelectric therapy, provides temporary pain control, should only be used as part of a total pain management program. Copyright 2023, Elsevier Inc. All rights reserved. 36. Anesthesia, local anesthesia, injected or applied to skin or mucous membranes. And spinal or regional anesthesia blocks pain from legs or abdomen, when general anesthesia causes loss of consciousness. Gas or injection, neuroleptinesthesia. Patient can respond to commands, relatively unaware of procedure, no discomfort. Copyright 2023, Elsevier Inc. All rights reserved. 37. Anesthetics, Table 4-3 tour. Anesthetics. 1. Local anesthetic. 2. General anesthetic, relative or neuroleptinesthesia. 3. Spinal anesthesia. Example, lidocaine, injected or topical, may add epinephrine, intravenous thiopental sodium inhalation, gas nitrous oxide, diazepam or droperidol. Local anesthetic injected into subarachnoid or epidural space around lower spinal cord. Effects blocks nerve conduction sensory in a peripheral nerve, affects brain, partial or total loss of consciousness. Can respond. Blocks nerve conduction sensation at and below level of injection. Copyright 2014, 2011, 2006, 2002, 1997 by Saunders, an imprint of Elsevier, Inc., purpose removal of a skin lesion, tooth extraction, general surgery, no pain, awareness when combined with analgesic, surgery on lower part of body, labor and delivery, copyright 2023, Elsevier, Inc., all rights reserved. 38.